Hi, this is Dr.AYYAPPAN V NAIR, and in this particular video I'll be discussing about a particular surgery called as reverse shoulder arthroplasty or reverse shoulder replacement. So this is a shoulder replacement surgery which is slightly different from a regular or anatomic shoulder replacement. So before going into the details about this particular surgery, I will just try to elaborate on the relevant anatomy. So the shoulder is basically the ball socket joint. So we have the bone here called as the humerus bone, which goes up and mushrooms and forms the ball or the head of the humerus. This sits inside a socket. The socket is part of a bigger bone behind the shoulder called as the scapula or the shoulder blade. So this is the ball socket. This is the arm here, the humerus bone. The upper part is called as the head of the humerus, and this is the socket. And we have a lot of muscles which are around the shoulder called as the rotator cuff muscles, which are shown by this in blue. The main lifting muscle of this rotator cuff is called as the supraspinatus, and another called infraspinatus, also quite important. We have totally 4 muscles there, that is subscapularis, supraspinatus, infraspinatus, and the teres minor. The integrity of all these muscles are important in getting shoulder movements. So now, what happens is, in certain conditions, we have to replace the shoulder. That means we have to remove certain injured or arthritic parts of the shoulder, and we have to replace it by steel or plastic, that is the shoulder replacement. So here what we do is, in a reverse shoulder replacement, the position of the ball and the socket are interchanged. The socket is like this now, and a new ball is put in this position. So because it is a reverse of an original or the normal anatomy, it is called as the reverse shoulder arthroplasty or the reverse shoulder replacement. And now we should not confuse this with a procedure called as the total shoulder replacement. In total shoulder replacement, what we do is, so this is the ball and this is the ball socket joint as a normal shoulder. So here what happens in severe arthritic cases, we just replace an existing ball by a steel ball, and the socket is replaced by plastic. That is called as total shoulder arthroplasty or total shoulder replacement. So there are certain indications for a total shoulder. A total shoulder, that is, we replace the existing anatomy, and that is, a ball is replaced by a ball which is steel and plastic. Socket replaces a normal socket. This is called as a total shoulder. This is done in severe arthritic conditions of the shoulder, like rheumatoid arthritis or any other infection to the shoulder, and where the shoulder surface, the joint surface, completely eroded off. The main prerequisite of doing this total shoulder replacement is that our muscles, that is the rotator cuff muscles, should be intact. When it is not intact, that means the shoulder rotator cuff muscles are not acting anymore and it doesn't help in the shoulder movement, then we have to do the reverse shoulder. So I'll just sum it up again. Total shoulder replacement is a procedure where your normal anatomy is recreated. That is, a ball is replaced by a ball and socket by a socket. It is done in severe arthritic conditions of the shoulder, provided the rotator cuff or the supraspinatus muscle and other muscles helping lifting the shoulder are intact. Now, in certain conditions where we have a big muscle tear, that is, the rotator cuff muscle is completely torn and it has gone back to from its original position, that is, it has shrunken in size as well as in length, and it has gone back or retracted. We call this particular condition called as a massive, irreparable, retracted rotator cuff tear. And we surgeons, we also consider certain criteria. So where this is called as the Hamada criteria. In Hamada explains the different classification. Hamada says stage 1 and 2 are less arthritis. So if it is severely arthritic, that is, if we have a massive muscle tear which can't be repaired, and we have a Hamada 4 and 5, which is severe arthritis of the shoulder, and with severe fatty infiltration of the muscle. This particular muscle gets shrunken, and also a lot of fat gets deposited in the muscle, which we can see on an MRI. And if it is severe fatty infiltration like Gotelier 3 and 4, then we do a reverse shoulder replacement. Reverse shoulder replacement is also done in certain fractures. For example, we have a proximal humerus, or the head of the humerus, we have a fracture. So this gets fractured into multiple pieces. So if it is a very bad fracture, like the ball socket, the ball gets cut in the middle, called as a head splitting fracture. That is, this is called the head of the humerus. If the head is split in the center, or a head splitting fracture, then the chances of such a shoulder getting its normal function with a regular fracture fixation will fail. It doesn't happen. In these conditions, again, we'll have to do a reverse shoulder replacement. The another is, if there are certain criteria in shoulder fractures. So the moment we see an X-ray or a CT scan of a fracture, of a proximal humerus fracture, we can make out if the fixation technique, that is, we're going to fix it with a plate and screw, if it will succeed or not. So there are certain criteria called as the Hurtle's criteria, where when the surgeon looks at the CT scan and finds that it is a very, very unstable fracture, then it is better that we do a shoulder replacement or a reverse shoulder replacement in such patients. And especially if the patient is more than 65 years of age. Then last would be like, we also do a reverse shoulder replacement in conditions where there is severe arthritis. So I was telling you earlier that in total shoulder is done in severe arthritis, but the cuff is intact, muscle is intact. If there is severe arthritis and the muscle is not there, or there is muscle insufficiency, or the muscle is torn in such cases, then we have to do a reverse shoulder. To sum it up, so we have the shoulder replacement, which is of two types. That is a total shoulder replacement and the reverse shoulder replacement. Total shoulder is done in arthritis where the rotator cuff muscle is intact. The reverse shoulder is done in severe arthritis where the cuff is not there. It is also done in severe muscle tears or massive irreparable muscle tears with certain criteria. Arthritic criteria shows that there is severe arthritis, and also in unstable fractures of the shoulder.